What's going on, everyone? Happy Monday to everyone. Hopefully everyone is doing well, staying safe and healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, hopefully you have a full and speedy recovery with no long COVID issues. It is time now for the Monday edition of the Pandemic Update for Monday, August 28th, 2023. That's right, my friends. This is the last Monday in August, which means more schools are going back. There'll be more that go back next week, but we have already seen cases of illnesses, some being COVID, some being, they're stating just mysterious illness. As you'll see here, Tipton High School is closed. This high school is closed Monday due to illness, and I believe this is in Indiana. So Tipton High School announced on their Facebook page that the school will be closed Monday due to illness. The school said classes will resume on Tuesday. And let's read what it says here. Good morning. Due to a sudden increase in reported illnesses among staff, our campus will be closed Monday, August 28th, 2023. We apologize for any inconvenience this may have caused our families today. School is expected to resume as scheduled tomorrow because, as you know, you only need one day to get better. I'm sure they'll be just fine by tomorrow. Well, that's silly. Just one day. I mean, I get it. It's tough and everything, but people need more than one day to get better. I don't see how they're going to resume staff tomorrow. Maybe they'll find more subs. I don't know. Because, yeah, as we all know, staffing shortages aren't an issue right now. Oh, wait, they are. We report on that, too. All right, speaking of schools, there's this problem. This could be school bus drivers. This could be bus drivers in general. Just bus drivers twice as likely to be hospitalized for severe COVID-19. Let's just read some of this. Bus drivers were at double the risk of being hospitalized for severe COVID-19 in the later stages of the pandemic. Remember, folks, we're still in a pandemic. And several occupations in education and healthcare were also at risk of serious illness. This has been shown by a study at the University of Gothenburg. The study is based on large amounts of data from several different registers. In total, 552,562 cases of COVID-19 infection and 5,985 cases of severe COVID-19 infection. Those cases, based on hospitalizations from October 2020 to December 2021, were then cross-referenced with the person's occupation in November of the previous year. The study compared occupations that involved working closely with other people and occupations that had little or no close contacts with colleagues or the public. Now, I'm not going to continue to read the rest of this, but you get the idea here. Out of that, what they found was bus drivers were twice as likely to be hospitalized for severe COVID. I did tweet this out somewhere. I'm also going to put this on the website. In fact, I think it might already be on the website. One of my members on my site, I think, did post it. So check the website. If it's not there, I will add it. But this is a fantastic study. I want you to read the whole thing if you do have time. All right, read this. An increasing number of Mississippians, this is Mississippi, are being hospitalized for COVID-19, data shows. And yes, Mississippi is not immune. No state is immune. It's rising in Mississippi as well. See what it says here. There were 121 hospital admissions for COVID-19 in the state during the week ending on August 12th. According to data from the Centers for Disease Control and Prevention, that's a 21% increase from the previous week. Now, this is going back to August 12th. We're at August 28th, but you get the idea. Mississippi is rising, and how often do we see a news story on COVID from Mississippi? We don't, so I really did need to share this, and I know I have followers from Mississippi. All right, now moving on to the BA.2.86 variant tracker, where we will take a look at the number of cases for this around the world, and this has increased. It was 13 and it increased to 15. Denmark, 4 cases. U.S., United States of America, 3 cases. South Africa, 2 cases. Portugal, 2 cases. Israel, Switzerland, Thailand, and the United Kingdom all have 1 case of this new variant. However, we have been seeing on Twitter, or at least I have been seeing on Twitter. I think I might have retweeted a couple of them. I don't know. Did I? I will if I didn't. Wastewater samplings where people are tweeting saying that it's being detected in some wastewater in some different places around the world, even a couple different states. I think I saw Ohio now. It's being detected in wastewater, so it's only a matter of time until we see more cases of this variant. All right, moving on to this now. This I thought was very interesting. This is from Hubbub World. I love the stuff that they do. Later on this week, we're going to be looking at their website. Either Wednesday or maybe Thursday, we will do a local prevalence check from Hubbub World. But this is for Pennsylvania. Pennsylvania COVID-19 weekly forecast, August 28th. It says Philadelphia has very high local prevalence at up to 184. So remember, with Hubbub World's data, I've showed you this before, just a little refresher, they're talking about 184 potentially infected people who could be sick with something within a 5-minute walk of an area. And it also says it's increasing rapidly again due to F-G variants. So this is not good. Pittsburgh is very high at 76 area, and they got skyrocketing symbol there, so apparently it's going up. And central Pennsylvania is also high in skyrocket. Speaking of central Pennsylvania, come down here to Penn State University. Who remembers my old pandemic updates? We used to talk about State College Mountain Nittany Hospital. Well, we can't do that anymore because they don't have the dashboard anymore for hospitalizations. But look at this. This is not good at all. Estimated cases at Penn State University right now between staff and students. 834. That's not good. They've only been in class for 1 week, and already there's an estimated 834 estimated cases. That's not good at all. And coming up soon, football season. Beaver Stadium, Penn State football. That stadium on the biggest games, not the first game, because it's not as big of a game, but on the biggest games, the record attendance for that place is 110,000 something. Yeah, it can happen. So, yeah, it's a big attendance. It's a cause for concern. All right, now to something new that we have never showed before here on the pandemic update. Now, this data, it's from last week, but it's relatively irrelevant. This is where climate and health come into play. We already show you the air quality values, but we can now show you this. This is relatively new. This is a heat-related EMS activation surveillance dashboard. And you can see there's different colors on this map. The colors that are in this darker shade of brown down here, that is much higher than average EMS calls for heat-related illnesses. And take a look at this. You can see here, there's a lot of brown areas in the south, even a couple up in New England. And there's also several up in the north central region and in the northwest. Then you have this orange color, and then you have this slightly lighter shade color where that's near average. And then you also have some below average colors. You can see here, like for example, let's just go with the Barnes, North Dakota, much lower than average, which that is a good thing. But these brown areas, as you can see here, like we were here near Orlando and Osceola, Florida, you can see here, it's relatively high, higher than average. How about we come up here to Maine? Here's Washington, Maine, much higher than average. And it actually even shows the population in that county, and it says, hey, EMS is much higher than average for heat-related incidents. So that's not good when you see it higher in some of these areas. We'll take a look at more of this in the coming days. I'm still trying to learn this dashboard because this is relatively new. It just started this year. Believe it or not, Biden administration did start this. All right, we do want to take a look at the air quality values, and you're going to see a whole mixed picture. We're not terribly concerned about the air quality in the south right now. Obviously, if you've been following the news, if you've been following my other channel at Climate Data Report, in the south, we're worried about Idalia, which is going to be a hurricane of any hour now. It's going to be turned into a hurricane. It's already a tropical storm. Some yellows in the northeast, but you can see overall, not terrible. And then, of course, we have to talk about the west coast. I mean, unfortunately, yet again, you still have this area. It's not fully coming up on the screen, but it's there. There it goes. Yeah, look at this. This is just This is just really bad. Bad air quality. You have fires that cause this, and it's just really sad that, I mean, wow. 665 area. If anyone knows why there's an area that's 665, let me know down below. That's one of the highest readings I have ever seen. That is like, do not leave your house. Shut your windows and doors. Air purifiers on the maximum. That's really bad. Alright, here's my other channel, at Climate Data Report, where I do talk about all things climate. Alright, we have to get to Walgreens. I know, we're running behind today. We're just going to do some states today, and then we'll do some more tomorrow, and we may even have to finish it out on Wednesday this week. The national positivity trend is at 43.6%. The prior week is at 44.9%. That's a difference of down. Yes, down. This is good news. Down 1.3%. One of the big reasons why it's down 1.3%, look at this. The total number of tests has finally gone above 5,000. 5,238. That's a decent size testing increase. And the prior week was 4,468. So while that's a good thing that that's up, that's also signaling that, you know what, more people are feeling the need to say, hey, you know, so-and-so just tested positive, or I'm not feeling well. Let me go get tested and see if I have COVID. And I think that's happening. So let's go through a few states. We'll go through a few states on the West Coast, then we'll go through a few states on the East Coast. Hopefully we'll get through all the states at some point this week. Starting off with Washington. Washington is 36.2% positivity. The prior week is 43.6%. That's a difference of down 7.5%. Testing, it's also down 47 versus 55. Oregon, 33.3% this week. Prior week was 50%, so this is a big decrease. Difference of down 16.7%. It's still way too high, but 33 tests versus 30, it is a legitimate drop. Then we come over here to California. 48.6% this week, 51.7% last week. Difference of down 3.2%. Total tests, 348 versus 487. That's a big decrease in testing, and yet the positivity still dropped. That's a good thing, but again, positivity overall there is still way too high. Nevada, 52.1% this week, 51.4% last week. That's up 0.8%. And testing is 71 versus 74. Not that big of a decrease in testing. We will call this a somewhat of a rise. Arizona, 41.4% this week, 48.2% last week. Down 6.8%. Total tests, 116 versus 110. This is a legitimate drop because testing is down. All right, how about Idaho? Nope, we don't have Idaho. We don't have Montana or Wyoming. Any of these states in the white, but you've noticed some of them, the color is so eerily similar that you can't actually click on them. Let's go over to Colorado. Colorado is 27.5% positivity this week, 33.9% last week. It's a difference of down 6.5%. Total tests, 51 versus 56. How about Utah? Utah is 41.2% this week, 42.9% last week. That's a difference of down 1.7%. And 17 tests versus 14. So testing did go up, positivity dropped. Still too high, but hey, it dropped. Now we come down here to a state that's in the red. New Mexico. This is not good. New Mexico is 38.9% positivity this week. Prior week was 33.3%. That's a difference of up 5.6%. Total tests, 18 versus 12. So yes, that is a legitimate rise because, hey, testing is up. Texas, 47.5% this week, 45.5% last week. That's a difference of up 2%. Total test is 1,484 versus 1,035. Great to see that testing is up in a big state like Texas. Hopefully that continues. Alrighty, let's skip to a couple eastern states. Connecticut, 40% positivity. Wow, this is not good. 26.3% last week. Difference of up 13.7%. And testing was down slightly, but it's such small numbers of testing, and that positivity is really high. So overall, that is concerning. Let's come down to New Jersey. New Jersey is at 41.5% positive this week. The prior week was 38.8%. Difference of up 2.7%. Testing did drop. 94 versus 103. And a state like New Jersey, Connecticut, anywhere along the coast. It's going to get mighty crowded on Labor Day weekend, so that's something we have to concern ourselves about, as a lot of people will be going to the beach areas. Alrighty, we'll do some more states tomorrow. I promise we'll try and get to eventually every state by the end of this week. Taking a look at BioBot, wastewater, you know the deal. The northern states like the Midwest starting to drop. The Northeast, it's still going up a little bit. The Southeast is starting to drop. The West, it's still rising slightly. Is this the peak? I don't know, because we have Labor Day weekend and we have colleges just starting. It could temporarily drop and then go right back up again, or maybe it's going to peak. I don't know. I'm not going to predict the future here. I mean, I would suspect there's going to be some COVID cases. The one thing I will say, I would suspect with the holiday weekend coming up and with more people sick now, I would suspect that leads to more people. You know, people have family gatherings. There's a lot of Labor Day traditions that do go on. I see pictures on social media. Oh, we have our big lake parties and this and that. And we know outdoor transmission's real, so it can be spreaders for COVID. All right, moving on, taking a look at the CDC wastewater. If you did not see yesterday's wastewater update, it is the video that we did yesterday. That's the only video we did on this channel yesterday. Not going to do any wastewater scan sites today, simply because the video would just run too long today. We do now want to skip over to New Jersey. And in New Jersey today, 272 hospitalizations. You're probably thinking, wow, that's great. It dropped. Halt for a second. 61 hospitals out of 70. 9 hospitals did not report. And we know as of lately, New Jersey has been correcting itself with these numbers. So when it does come back to full hospitals reporting, this 272 that's now in the books for today may get changed, because we've seen it happen a few times now. 11 people on a ventilator. In the ICU, there's 30 people in the ICU in New Jersey. All right, we have to talk about Philadelphia. Going back to Pennsylvania, 767 EMS incidents reported yesterday, but I do want to show you, did they do the weekend total yet? No, they did not. This I want to show you. On Saturday was a super busy day in Philadelphia for EMS incidents. 870 of them. And as you saw from Hubbub World, let's go back to that Hubbub World for a second. You can see here on Hubbub World, look in southeast Pennsylvania, Philadelphia, rapidly rising COVID. So we have to wonder, are they seeing an increase in the number of COVID EMS calls? Let's do a live look-in real quickly. We're late today. It's 5:57 p.m. Let's see what's going on in the suburbs. And here's Montgomery County. There's a few calls out there right now, 11. And I see 3 of them are respiratory emergencies. And wow, look at this, Chester County. Again, another 3 respiratory emergencies, or difficulties they call it. And I've been following this more closely lately. Both of those counties, and I sometimes look at Delaware County. I can't show you that here because it's more jumbled. It's all paragraphs. It's really hard to show. But I've been seeing a lot more calls that are saying respiratory difficulty. And based on the prevalence increasing, you have to suspect they're getting more COVID calls. We don't know the exact number of them, but we have to suspect it is happening. Alrighty, let's take a look at New York State, and I think New York State's going to be where we end for today. In New York State, under the most recent update, which finishes last week, 920 new positive cases. The positivity, it continues to rise, 15.9%. This is on New York State, their statewide positivity. And the 7-day average is now 14.6%, while the one-day positivity is 15.9%. So that's not good. 15.9% is bad, and at this rate, I would suspect it's probably going to pass 16%, but we shall see. Taking a look at New York State hospital admissions, and I wanted to show you this. The overall hospital admissions in New York State, look at this. It's continuing to rise. Tomorrow we will start the new week. It's going to be very interesting to see what happens. And now let's take a look at the actual number, how they finished last week. Again, tomorrow starts the new week, and they finished last week with a rise in ICUs. 116 people in the ICU, 1,050 people in the hospital. Let's take a look at New York City. Should come up here. And in New York City, 481 people in the hospital, 56 people in the ICU. So both numbers here did go up. Let's also take a look at Long Island. What's going on there? Long Island hospitalizations dropped. 183 people in the hospital. 29 people in the ICU. The ICU did go up by 1. And let's take a look at the capital region real quickly, and then we will end after this. Oh, wow. So the capital region, look at this. It's like a little step. It's going up. And it went up big on the end of last week. 49 people in the hospital, but only 1 person in the ICU. The ICUs in the capital region of New York have decreased. That's a good thing. Alrighty, folks. That does it for today's pandemic update. We'll have another edition of the pandemic update again tomorrow. I promise you we will include some international data tomorrow and a few other things. So if you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs to see this content or would enjoy watching these videos, by all means, share this with them. I will see you all again next time. Until I see you again next time, stay safe, everyone. Have a great evening.